Hi everyone. Today we hear from a frontline nurse in New York City about her experiences dealing with and caring for patients with COVID-19 in an intensive care unit.
I'm working as a registered nurse in an ICU in Manhattan. I've been a nurse for about 12 years. But the people in the ICU that we get who are on ventilators, for example, not a lot of them are doing well or will do well. They're very, very sick, and some of these people, it's going to take a miracle to get them off of the ventilator. So in some ways, it's brought us all together because we celebrate the ones that actually do. You know, some of these patients, they come out of the ICU and we all share this joy. It's really a time of major anxiety. We are all just so terrified. This is not a joke. This is extremely serious, and it's affecting a lot of people. I find it very upsetting that people think maybe this is like dramatized on the news or something, because these are patients who otherwise are living their day-to-day in a normal way. Some of them are healthy, some of them were not, contracted this terrible virus, are now facing death possibly, and in this very scary way to die, and their families are not allowed to be at the hospital. Their families are sitting at home knowing that their family member is dying and cannot say goodbye, cannot see them, cannot at least make sure that they're comfortable. And then you have people saying, oh, this is the media, it's too much. It's really upsetting to me. Just because you can't see it up close yourself, and just because it's not directly affecting your family doesn't mean it's not real. It's been challenging to see all the media coverage of this in different ways. I mean, my whole job is revolving around COVID right now, and everything I see in my personal time is related to COVID. So it just increases my anxiety personally, and it's too much sometimes to handle, to be honest with you. I think it's also difficult to see certain things on the news, and it's very obvious that they don't understand. For example, they always talk about ventilators, and we need ventilators. We do need ventilators, and that's wonderful that they're trying to get them to us. But there is other equipment that we don't have. High-flow nasal cannula is a big one that we're running out of, and that's helping a lot of our patients. The BiPAP machines, they're helping a lot of our patients. We need that stuff. Propofol, fentanyl, medications that we're using to sedate some of these people, we're running out of that. We need that stuff too. People, for the most part, I think are really taking this seriously and staying inside and washing their hands and wearing cloth masks, or some are, wearing regular masks outside. I think it's great. I really appreciate it, because this thing would have been drastically worse if people didn't stay home, if the general public thought, oh no, I'm just going to go to a restaurant, or if the restaurant thought, I can't close, I'm just going to stay open, or if the public didn't cooperate, this would have been a nightmare, and more than it is. So we're very grateful. We're very, very grateful, because it impacts everyone financially, and family members can't see each other. And I know that it's very difficult for everyone. So we're so grateful to the general public for letting us do our job.
Thank you to this nurse on the front lines for sharing her experience, the challenges as well as the successes during the COVID-19 pandemic. We are all in this together.